If you're over 60 and you take medication for blood pressure, you've probably asked yourself this question at least once. Can I still take vitamins? Or am I making things worse without realizing it? It's a quiet concern. Most people don't talk about it openly because on one hand, you're trying to support your health, and on the other, you don't want to interfere with medication that your body depends on every day. What makes this even more confusing is how much conflicting advice exists online. Some sources say vitamins are harmless. Others warn that supplements are dangerous. And many people are left stuck in the middle, unsure what is actually safe anymore. Today, we're going to slow this down and bring some clarity, not by listing dozens of supplements, not by giving aggressive recommendations, but by carefully looking at 3 vitamins that are generally considered compatible with common blood pressure medications when used thoughtfully and moderately after 60. We'll also talk about why certain popular supplements are often not recommended for people on blood pressure meds. This isn't about doing more, it's about doing what's appropriate for your body now. Why vitamins behave differently after 60. Before we talk about the specific vitamins, there's something important to understand. After 60, the body processes both medications and nutrients differently than it did earlier in life. Absorption changes, liver metabolism slows slightly, kidney clearance can become less efficient, and most importantly, the margin for error becomes smaller. That doesn't mean supplements are forbidden. It means they need to be chosen with context, especially when medications are involved. Blood pressure medications work by influencing how blood vessels relax, how fluid is handled, and how signals move through the nervous system. So anything that also affects muscles, nerves, electrolytes, or circulation needs to be approached carefully. With that in mind, let's talk about the first vitamin that many older adults tolerate well when used properly. Vitamin number 1, magnesium. Specific forms matter. Magnesium is one of the most discussed minerals when it comes to blood pressure, sleep, and muscle function. But here's what often gets overlooked. Not all magnesium behaves the same in the body, and after 60, form and timing matter far more than quantity. Magnesium plays a role in nerve signaling, muscle relaxation, and how blood vessels respond to a stress. This is one reason it's often mentioned in discussions about nighttime blood pressure and nervous system calm. However, some forms of magnesium are poorly absorbed and can cause digestive upset or unpredictable effects. That's why many older adults are advised to avoid magnesium oxide, which is absorbed poorly and tends to act more like a laxative. Gentler forms, such as magnesium glycinate or magnesium taurate, are often better tolerated. They're less likely to cause digestive distress and tend to support calm rather than stimulation. Another important factor is timing. Magnesium taken early in the day may support a stress regulation. Magnesium taken later in the evening often supports muscle relaxation and sleep continuity. But combining magnesium with other supplements or medications at the same time can sometimes reduce absorption. This is why spacing matters. Magnesium doesn't need to be high dose to be useful. In fact, moderate, consistent intake is usually better tolerated than large amounts taken all at once. For many seniors on blood pressure medication, magnesium is less about lowering numbers and more about supporting the nervous system, so the body doesn't overreact to normal fluctuations. Many older adults notice that when magnesium levels are adequate, the body stays calmer through the early morning hours. sleep feels less fragile, and small hormonal shifts are less likely to pull them awake. Vitamin number 2, vitamin D, low to moderate, context matters. Vitamin D is one of the most misunderstood nutrients in senior health discussions. It's often treated like a cure-all, and that's where confusion begins. Vitamin D does play a role in how calcium is regulated, how muscles function, and how blood vessels respond, but it does not act like a blood pressure drug. And higher doses do not automatically mean better results. After 60, many people have lower vitamin D levels due to reduced sun exposure and changes in the skin synthesis. At the same time, vitamin D interacts indirectly with calcium metabolism. That matters because calcium balance affects vascular stiffness and muscle contraction. This is why vitamin D needs to be approached carefully when blood pressure medications are involved. Low to moderate supplementation is often discussed as supportive. Very high doses, especially without monitoring, can increase calcium levels and create unintended strain. Another key factor is consistency. Vitamin D works slowly. It doesn't create noticeable effects overnight, and it doesn't need aggressive dosing to function. For many older adults, a steady, moderate intake supports overall balance without overstimulating the system. Vitamin D is best absorbed with a meal that contains some fat, and because it stays in the body longer, it doesn't need to be taken multiple times per day. The goal with vitamin D is not to chase a sensation, it's to support stability. Vitamin number 3, CoQ10, especially relevant with statins. CoQ10 is sometimes described as a vitamin-like compound, and while it isn't technically classified as a vitamin, it behaves in a similar supportive role. This becomes particularly relevant because many people over 60 take both blood pressure medication and cholesterol-lowering drugs known as statins. Statins can reduce the body's natural production of CoQ10. For some individuals, this shows up as muscle fatigue, lower energy, or reduced exercise tolerance. CoQ10 plays a role in cellular energy production and muscle function. It also supports how blood vessels respond to physical demand. This doesn't mean everyone needs it, but for seniors who take statins alongside blood pressure medication, CoQ10 is often discussed as a supportive option. What matters here is expectation. CoQ10 doesn't lower blood pressure directly. It doesn't replace medication. It simply supports cellular energy in systems that are already working harder. Some seniors describe this as feeling less drained during the day and less physically tense at night, especially when CoQ10 depletion is related to long-term statin use. CoQ10 is usually taken earlier in the day as it can feel mildly energizing for some people. As with other supplements, moderation matters. More is not better, and effects, when they occur, tend to be gradual rather than dramatic. Supplements. Often avoided with blood pressure medications. It's just as important to talk about what not to combine casually with blood pressure meds. Potassium supplements are a common example. While potassium from food is generally well regulated by the body, supplemental potassium can be risky for people on certain medications. Some blood pressure drugs already increase potassium retention. Adding supplements on top of that can disrupt heart rhythm and electrolyte balance. Herbal stimulants and aggressive circulation boosters can also create unpredictable responses, and large doses of combined supplements taken without spacing or context increase the chance of interactions. This is why safety matters more than trends. How to think about supplements. After 60, here's the most important takeaway. Supplements should not be chosen based on fear or urgency. They should be chosen based on compatibility, timing, and your body's current needs. Blood pressure naturally fluctuates. Sleep affects it. Hydration affects it. Stress affects it. The goal isn't to control every number. It's to support the systems that help the body regulate itself calmly. If you're ever unsure, bringing a supplement list to a healthcare provider is one of the simplest safety steps you can take. That conversation matters more than online opinions. Gentle closing. If you're over 60 and you take blood pressure medication, you're not fragile, but your body does require more thoughtful support than it once did. Small, careful choices often make the biggest difference. If this explanation helped clarify things for you, you may want to explore related topics next. On this channel, we focus on how vitamins, supplements, and everyday habits interact differently after 60. Without hype and without quick fix promises. If that kind of calm, safety-focused guidance is useful to you, consider subscribing so you don't miss future discussions. And if you're curious about how specific vitamins behave when combined with common medications, you'll find a full playlist linked below that explores those interactions in more detail. Everything shared here is educational. If you're considering changes to supplements or medications, it's important to discuss them with a healthcare professional who understands your personal history. Your body deserves clarity, not confusion, and thoughtful care is always the safest place to begin.